we need to do this. And why Dr. Shetty is because, Anup's been organizer of Holistic Medicine Conference at TexMed for the last 5 to 6 years, since 2014 to 2019. He's a motivational speaker, and he did his medical school and in India, in Manipal, and he did his nephrology fellowship. He's a nephrologist with interest in peritoneal dialysis and caliphalanxis, and he did that in Henry Ford Hospital's nephrology fellowship. And he has been a speaker, he's a writer. He's written 2 books, the latest one being The Power of Infinity, Health, Well-Being, and it's got a tagline, Health, Well-Being, and Anti-Cancer Lifestyle. And he's also on TikTok as Infinity Shetty, and he puts out smoothie recipes. So he's a very well-rounded, interesting personality. And but the most important thing is he's a cancer survivor for over 15 years, and that's why he has the credibility to talk on this topic, which is cancer preventable? So let's hear from him. It's a very interesting talk, and let's give him a big round of applause.
Good evening. Thank you all. Thank you for waiting for me. I deliberately kept my talk at the end, so if somebody gets its time, then I get to talk less. It's one way of respecting the invited speakers, so we don't cut into their time. And I know it's a Saturday. Thank you for waiting till now. But before I start the talk, I want to thank Vinny, thank Sumana. We made a great team, I think, and I hope you all enjoyed the program. And thanks to CME committee. I know Nitanak is here, and Kiran, of course. And of course the TIPS board. Thank you for supporting, and thanks to all the sponsors. And most importantly, thanks to you. I also want to thank my doctors who helped me. And it's 19 years since I survived cancer. So, okay. So, when we talk about diabetes, when we talk about heart attacks, we see them as preventable. But when somebody develops cancer, we don't see it as a preventable disease. First thing, at least I heard, is what's going to happen to your kids. So we think of death. We think of death when we talk about cancer. That's the first thing that comes to our mind. And if you really see, many of the cancers are preventable. They are not 100% preventable. Nothing in medicine is. But a lot of cancers are preventable, and it's my goal to convey that message to all of you. And it's my goal to convey to people who are around me and who are on the social media, or whoever listens to me or reads about me. And indeed, American Institute of Cancer Research also states that nearly half of cancers are preventable by some changes in our lifestyle and every day-to-day habits. The other thing to know is cancer is not one disease. People ask when somebody develops cancer, is it cured? When are you going to have cure to cancer? I am a nephrologist, and first thing I thought of when I had cancer is, thank God I don't have end-stage kidney disease. Because end-stage kidney disease is much more dangerous than a lot of cancers. Okay? But most of the other illnesses, they don't elicit the same emotion that cancer elicits. It's a very emotional disease. So that was me. I was 41. So this is what gave me qualification to talk to you in front of you all. That was my rectum. There was a mass that the GI surgeon found. And He called Dr. Manga to look at it before he woke me up. Thank you, Dr. Manga. Because he was also surprised. Okay? I didn't have any risk factors to have cancer. In fact, I'm the first one in my family. But things happen. But good thing is I'm here in front of you talking about it. So I struggled for many years what good came out of this. Because one of the things that I read is see good in everybody, see good in everything. But it took years for me to know what good came out of this. So one of the things that I realized is, unlike what we normally think, cancer is not a rapidly growing disease except in later stages. And just like most illnesses that you heard, it takes decades of unhealthy something, lifestyle or something that happened to you before you get a illness. If you take diabetes, for example, it takes years of lifestyle, unhealthy lifestyle to develop diabetes, and it takes another decade, a decade and a half for them to develop proteinuria. And I come into picture there. So by the time I see the patient, it's too late. It's 30 years late. And the story is similar to most of the chronic illnesses that we manage. And we try to fix once the damage is done. It's too late. So that's why we have this symposium. And thanks to Amit, this is your legacy. Thanks. So to give you an example of colon cancer, majority of the colon cancer, they don't just show up one day. They start as a benign adenomatous polyp usually, and over time, about 30% of these such polyps become cancers. So if somebody somebody undergoes screening colonoscopy, and if they remove these polyps, there is no polyp to become cancer. So this is one of the preventable cancers. And that's why I have made it a mission that in all my patients in medical decision making, I have under anemia, kidney patients become anemic a lot of times. As part of that, I include if they had screening colonoscopy or not. If they have not had it, I write down why they didn't have it. If they had it, I write when they should have their next colonoscopy. We already talked about this. So this is a picture of polyp of one of my patients who had colonoscopy and polypectomy recently. That is one cancer prevented. So that is a good thing that came out of me having cancer. And I've had many such patients who have had polypectomy. So we can prevent some cancers. In fact, we can prevent many cancers. So what is the cancer load to the community? I was amazed actually. 2 million, it's estimated that about 2 million people will get diagnosed with some cancer or other in the US. And over 600,000 people die from cancer. Worldwide, about 20 million new cancers are going to be diagnosed, were diagnosed in 2022. And we can't be treating all these, we have to prevent them. And if you see, cancer, this is a busy slide, you don't have to read it, but you all know the common cancers. Common cancers are breast cancers, colon cancers, lung cancers, prostate cancers. Okay. I'll skip this. This is actually the summary slide of my talk. This is from National Cancer Institute. So what do we learn in medical school? How do you fix a problem? Fix the cause, right? Treat the cause. If you know the cause, treat it. And thankfully, we do know the cause of many cancers. So all we have to do is to treat the cause. If smoking causes cancer, quit smoking. If infection causes cancer, we know that HPV causes cancer cervix. Now there is a vaccine for HPV. We know that hepatitis B causes cancer, hepatitis C causes cancer. We have a vaccine for hepatitis B. We have treatment for hepatitis C. HIV is associated with many malignancies, and HIV is a preventable disease and kind of treatable disease. H. pylori is associated with cancer of the stomach, and it's treatable. I talked about vaccines. We talked about the role of polypectomy. And surgery, I was surprised they put it here, but it's not that uncommon for women to have mastectomy. If they have mastectomy for breast cancer, many of them choose to have mastectomy on the opposite breast to prevent breast cancer. We all know the story of Angelina Jolie. She had bilateral prophylactic mastectomy. So many cancers are preventable. What is the contribution of different things, different habits, or different things that we get exposed to for cancer? Tobacco smoking contributes to around close to 25% of the cancers, are strongly associated with. Excessive body weight is associated with, or it's believed to attribute to around 6 to 7% of cancers. Alcohol consumption, another about 5%. UV radiation, another 4-5%. Poor diet, pathogenic infection, and inactivity. Tobacco is not just associated with lung cancer, but it's also associated with genitourinary cancers, kidneys, the urothelial cancers downstream, ovarian cancers, uterine cancers, nasal cavity, all the upper respiratory tract, stomach, liver, colon, pancreas, lung, of course, and some leukemias. So smoking is associated with a lot of cancers. What about e-cigarettes? E-cigarettes also are associated with cancers. Cancer risk with e-cigarettes is lower, but it comes with other problems. The nicotine content is very high in e-cigarettes. And e-cigarettes also deliver other toxins. Some of them are heavy metals. So even e-cigarettes are not any safe. Okay, now let me quickly go over some of the screening guidelines from American Cancer Society. Now some of these screenings prevent cancer. In other words, it's primary prevention, like polypectomy is primary prevention, unless the polyp is malignant already. If the polyp is malignant already and if it's localized, it's secondary prevention. But most of these screening procedures cause very early diagnosis of early cancers or diagnosis of precancerous lesions, preventing more advanced cancer. For breast cancer, the guideline is to have annual screening, starting at the age of 40, between the age of 40 and 44. I won't go into all the detailed guidelines, but I just want to highlight that. So mammogram, the abnormal mammogram diagnosis more precancerous lesion or early cancers. Okay, so I can't say it's a tool for primary prevention, but it's more a secondary prevention. What about cervix? Primary prevention is by HPV vaccination. Secondary prevention is by pap smears. And colorectal cancers. I personally, I'm a big believer that people should have screening colonoscopy, but the guidelines say they can have the multi-target stool DNA test every 3 years. This test detects cancer DNA. So the way I see it is screening colonoscopy is primary prevention, and this detect Cologuard, for example. Cologuard is a brand name, I have to disclose that, and I have no conflict of interest. It's a test after one has cancer cells. Any screening is good as long as people get some screening, but I personally feel that people should have at least one colonoscopy if they are fit to have it one. After that, it's up to them, it's beyond my expertise. Now there is a low-dose CT scan of the lung for screening for lung cancer among smokers. Prostate cancer guidelines, screening guidelines are very confusing. American Cancer Society says one thing and Urology Society says one thing, but they say let the patient make the decision. I mean, that's the way I say. They say you involve the patient and make a collaborative decision. It's a little confusing for me because my own doctor gave me guideline, do you want to have it? And I'm not an expert as a patient, so I wish they just made a clear guidelines, but prostate-specific antigen is available, and at least in high-risk patients, one should have it. African Americans are considered high risk, and generally prostate cancers are slow growing, but there are fast growing prostate cancers as well. So I'll leave it up to there, just like the guideline says, you get involved and you make an informed decision. So that is about screening. Now my favorite part, why do people get cancer? A lot of times, till I had it, we don't know the cause of cancer was okay for me. But when I had it, that answer was not okay for me. But there is a time to ask that question. Okay? If somebody develops cancer, first priority should be to treat the cancer. So don't ask why I got it. Just take care of the cancer. And once you take care of the immediate issues, then I think it's the right time to ask, why did I get cancer? So logically speaking, we have 5 pillars of health as defined by the College of Lifestyle Medicine. And in Ayurveda, which is an ancient medical discipline in India, they talk about 5 elements, which is earth, water, air, fire, and ether. In reality, both Lifestyle Medicine Society and Ayurveda, they talk about the same thing. And in reality, everything in the universe falls under these 5 categories. Everything you see around you, everything that you have, they all have 5 elements. Our body also has 5 elements. Body is exposed to 5 elements. So earth is solid food. Water is water and unhealthy water, like alcohol, sodas, colored liquids. Air can be healthy air or smoking or contaminated air, like chimney sweepers. Fire is the stress that we get exposed to, and internal hormones. And ether is the connection, the friends and family around you. There is sometimes they describe a 6th element, and that is mind. Okay? You can make mind part of ether or make it an independent element. But everything that we have in the body and everything we are surrounded by fall under these 5 elements. When there is a disharmony between these elements, body gets sick. When there is a harmony between these 5 elements in the universe and us, in other words, when we expose our body to unhealthy elements, body gets sick. It's not unique to cancer, it's for every illness we come across, it's because of problem in one of these 5 elements. So that's why you saw that last year we talked about cardiac health, GI health, and a little bit of cancer. This year we added neuro health and we added physician well-being. And we added a little bit of application of, one of the attendees said, you all talk about what to do, but you all don't talk about how to do it. Okay. That's why we invited culinary medicine expert. Okay. And point is, lot of illnesses in some way or the other, they are lifestyle illnesses. We don't realize that. The AICR guidelines, they don't cover the stress and sleep and human connections. They address the others. But nevertheless, they are very, very informative. We're supposed to finish at 4:30, so I'm going to go a little fast. Okay? But these are the things that we already have talked about through the day. One is be as lean as possible without losing strength. Okay? Having strength is very important. Okay? But be as lean as possible. Okay? I'm going to skip this. This is a quote from Tricia Pezzold. Cancer prevention happens in the kitchen. Now, how do we stay lean? Few things that I practice, even though I wrote a book on infinity, I tell my patient that anything you do should be very finite. Simple thing. If they say, I'm trying to do something, I tell them, don't try, just do something. Okay? And I give them example. I said, if you're eating 4 slices of bread, if you're going to tell me you're going to eat 2 slices of bread, that is very finite. Your 2 is my 2, my 2 is your 2. Okay? Nobody can question it. So I try my patients to tell me what they're going to do in finite statement. Okay? I'm going to not have soda. That is very finite. Okay? I'm going to try to not drink soda. That is not finite. I'm going to cut down soda. That is not finite. I'm going to cut down alcohol. That's not finite. I'm going to stop alcohol. That's very finite. Next question I ask is, when are you going to stop it? I tell them today is a good day. But I give them the choice. You don't have, if you've done this for 20 years, you don't have to do it today, but pick a day. And Christmas or New Year or Mother's Day, Happy Mother's Day to all the mothers. So it's important to be finite. And then whatever they do has to be safe. It has to be positive experience. Example of positive experience is diet somehow has a negative connotation. Lifestyle has a positive connotation. And if you read Pankaj Vij's book, he uses the word nutritional excellence. I found it very fascinating and positive statement, nutritional experience. So enjoy what you eat, but eat it healthy. Healthy lifestyle is a positive statement. Weight losing diet is a negative statement, kind of. Okay, it has a negative connotation. So, in other words, make people enjoy what they do. That way they can sustain it. Physically active says 30 minutes each day. I say 1 hour every day. It doesn't have to be, you don't have to go to gym, you don't have to do fancy stuff. I'm fortunate I have 2 dogs. They don't let me sleep if I don't walk them. Okay. 9 o'clock at night they come to me, they know that we have to walk. So rain or shine, I walk them. Unless if it's unsafe to walk, I don't. Like if there's a sleet, I don't. But if there's rain, I pick the umbrella and walk them and they enjoy it. So make it fun, make it every day. In Sanskrit, in Yoga Sutras, there is a statement. It says Dirgha Kala and Nairantarya. Dirgha Kala means prolonged period of time. Nairantarya means every day, like regular. So it works when people do same thing every day at the same time and same place. Okay? So you walk the same track every day, generally same time. In my neighborhood, you will see a white-headed guy walking at 10 o'clock at night, every night, rain or shine. So make it easy, make it consistent, make it regular. I tell people not 3 days a week, make it 7 days a week. Okay? We don't complain when we have to brush our teeth. Do we ever go to work without brushing our teeth? We don't, right? No matter how busy we are, we still brush our teeth. We still take shower. So make it unconditional. When I just added, I put 7,000 steps because I just exceeded 7,000 steps. Okay. So last few months I've been walking a little more than 7,000 steps, but somebody said 10,000 steps, that's great. Okay. Avoid sugary drinks. I'm going to go faster because we exceeded time. Predominantly vegetables, fruits, whole grains, legumes. In Texas, it's hard to tell people to become vegetarian. And what I tell them is, go on a plant-dominant lifestyle. PLADO, P-L-A for plant, D-O for dominant. I ask them, go on a plant-dominant lifestyle, increase your vegetable intake, and eat that before you eat any other food. Well, I'm doing 2 things here. I'm increasing the plant product, intake of plant products, and I'm indirectly decreasing the intake of other food by making them eat this first. And if you really see, you have a lot more choices if you are a vegetarian than if you're not. Somebody said rainbow. Think of rainbow, mixed colors. And all vegetables are good. This is what I tell my patient. Potato and corn is not vegetable, but you can eat all vegetables. Just eat whichever vegetables you like. Don't eat same vegetable every day. And there is I don't have slide on it, there is a healthy dozen and unhealthy dozen. Generally, if something cannot be peeled, buy them organic, like spinach, strawberries, apples, buy them organic. But like bananas, oranges, if you don't want to buy organic, it's okay. Other thing people complain about is cost. Cost is a factor, we have to be sensitive to it. But I tell patients, you are worth it, your life is worth it. There is nothing more valuable to you than you. So spend a little bit more. Don't go to the vending machine and get sodas. They are very expensive. People don't realize that. So wait, I'm going to skip all this. Limit consumption of red meat. This is evidence-based. Don't burn meat. So people who do barbecue, if you have to do it, I tell them barbecue with the skin, but don't. They follow cancer prevention strategies a little bit more than others. And finally, I'm coming back to the same slide we started with. To summarize, National Cancer Institute says lower cancer risk by avoiding tobacco in any form, both chewing and smoking. Treat the infections that are associated with cancer, especially hepatitis C, HIV, and H. pylori. Prevent infections which cause cancer like HPV and hepatitis B. And do screening colonoscopy. I strongly feel that colonoscopy is a way to prevent colon cancers. And before I stop, I'll tell you a story. After I had colon cancer, a lot of my friends started having altered bowel movements, or they got worried, and many of them had colonoscopy. But one of our nurses, she developed colon cancer at the age of 58, about 8 or 9 years after I had cancer. I really felt that, I had not told her, I didn't know how old she was, and I had not told her to have colonoscopy when I had colon cancer. But I felt that if she were to have colonoscopy after I had the diagnosis of colon cancer, that would have been another cancer saved. This is another way of putting AICR guidelines, which we already talked about. And last one, I made this up, 007, and I have to add 3 zeros at the end. So 0 sodas, and these are not purely evidence-based, but many of them are. 0 sodas and any drinks with sugar, 0 alcohol, 0 smoking, 7 servings of vegetables and fruits per day. It takes some effort to consume 7 vegetables and fruits per day. That's why I make smoothie every day, and I get 4 servings in the morning when I start the day. 7 hours or more of exercise per week, that makes it 1 hour per day. It doesn't have to be strenuous exercise, but do exercise, stay strong and fit. 7 hours of something fun. It could be yoga, it could be meditation, it could be dancing, it could be singing. Do something fun. Just so you know, see, I have colorful socks today. So I wear colorful socks at least once a week, and tell my nurses if they're wearing it too. So that's our Happy Socks Day. So, and 7 hours or more of sleep per day, and 7 hours or more of screen-free time per week, and 7,000 steps per day. Thank you. Thank you. Any questions?
Your smoothie recipe, please.
My smoothie recipe, 2 vegetables of your choice. Generally, I put organic greens, 2 fruits. I usually start with 1 apple and 1 banana, and then add whatever other fruits I want to add. And 2 scoops of plant-based or gain protein powder, and lot of filtered water. That's my base recipe. I might put little turmeric, little bit ginger, little bit black pepper, depending upon the day. But my base recipe is 2 servings of green leafy vegetables, 2 fruits, 2 scoops of protein powder, which gives me 21 grams of protein, and a lot of water. Don't put milk, don't put yogurt, that increases the calorie intake. And I don't buy coconut water, but if you want to be fancy and spend some more money, you can do that. But I just put use filtered water or bottled water. I use filtered water to prevent use of plastic.
Before any questions, we have a evaluation on the agenda form. It's a QR code. Please do your evaluations. That'll help you get your CMEs sooner, I guess.
Yeah.
Any questions? Okay.
If
Dr. Monga, let's have Dr. Monga.
Subjects very close to my heart. Anybody 40, 45 or above comes to my office, I tell them there are two causes of death in the United States. And you got to take care of both of them. One is heart disease, and second is cancer. Out of cancer, there are three cancers which are most important in men. One is the lung, prostate, colon, and in women it is breast, lung, and colon. And I tell them you got to do everything possible to prevent these. I mean, I am a colorectal surgeon practicing that for 40 years, but this is my prep talk to everybody 40, 45 or above. Come to my office. And I want to ask, suggest, request everybody, take his advice and practice that in your practice. Okay? Implement that in your practice. Advise, guide, educate your patients to prevent these cancers. Very, very important. And the second point you made, which another pep talk to my patient, I tell them, I don't care how much meat or cheese you eat. You must take 3 or 4 servings of vegetable every day and a couple of servings of fruits. These are two of my pep talks in the office. I want really everybody to take his advice and try to practice that in your practice. Thank you.
Thank you, Doctor.
Okay, last question.
Awesome talk, Anup. My question was more about your writing habits more than your exercise habits. And could you talk more about how you fit it into your 007 schedule?
How do
Since you're the author of 2 books, I'm very curious how you fit in your writing into your daily routine.
Okay, writing is, to me, writing is very emotional, so I have to be immersed in it and I have to get into that flow.
Yes.
Flow that Meli Chikchinjai, I don't know how to pronounce it, but flow, I've read that book. So you have to get into it. So when I'm writing a book, I'm thinking of book every wake time. Okay? But what people say is you dedicate at least half an hour or a finite period of time every day to write. So initially write the outline, write something that you are passionate about. So you have to have, that is your credibility. Okay? You are passionate about and you want to know more about. And write a little bit every day somewhere. You can write it in a book or you can write it in a laptop and keep writing. After 6 months or so, you will have enough material. And then put it together. So regularity is Dirghakala and Nairantarya is important. So writing a little bit on a regular basis. I said every day, but you don't necessarily have to make it every day. You can make it, say, every weekend. Every weekend dedicate a time, and that has to happen. And you have to enjoy it, of course.
Thank you.
Okay.
But there are no other questions. We'll wrap up this another fantastic meeting, CMA meeting on wellness and lifestyle. A shout out to Dallas County Medical Society, Dr. Casey, Dr. Fuller for your support, and let's see what we can do in the future.
Thank you. And please fill your evaluation. It's very important. We take it very seriously. We use that to plan the next year's CME. So it's very important. Thank you. And thank you, Rashmi. Thank you, Amrita.
Okay.